Good afternoon, everyone. I'm Councilmember Lynn Schulman, Chair of the Committee on Health. I would like to start by thanking my colleagues for being present today. We've been joined by Council Members Yeager, Arreola, Hudson, Velasquez, Narcisse. Today we'll be voting on a package of important legislation related to maternal health, mortality, and morbidity. In June, the Health Committee held a hearing alongside the Hospitals Committee following the Supreme Court's decision to overturn Roe v. Wade, reversing nearly 50 years of precedent and ending the federal constitutional right to an abortion. We discussed how this decision will have deadly consequences that will unfortunately fall hardest on Black women and birthing people who already face a severe maternal mortality crisis. Forced pregnancy policies will disproportionately affect people of color, immigrants, LGBTQ, IA+ individuals, young people, and those who are poor. While New York has more progressive laws protecting a woman's right to an abortion, we must continue to do work to improve maternal health outcomes. More people in the United States die of pregnancy-related complications than in any other developed country. And while the number of reported pregnancy-related deaths has been declining in most of the world, in the United States, the maternal mortality ratio has increased compared to similar countries. Across the United States and in New York City, maternal mortality disproportionately impacts Black women and birthing people, with Black people 8 to 12 times more likely to die when giving birth than their white counterparts. That is why today we'll be voting on a package of 7 bills and 4 resolutions that directly address the issues of maternal mortality and morbidity. This includes proposed intro number 409-A, sponsored by Councilmember Lewis, in relation to increasing access to data on maternal mortality and morbidity. Proposed intro number 472-A, sponsored by Councilmember Gutierrez, in relation to establishing a program in DOH-MH to train doulas and provide doula services to residents in all 5 boroughs. Proposed intro number 478-A, sponsored by Councilmember Hudson, in relation to an outreach and education campaign on the benefits and services provided by doulas and midwives. Proposed intro number 482, sponsored by Councilmember Lewis, in relation to requiring DOH-MH to provide information on polycystic ovary syndrome and endometriosis. Proposed intro number 490-A, sponsored by Councilmember Menon, in relation to requiring the provision of sexual and reproductive health services by DOH-MH. Proposed intro number 86-A, sponsored by Public Advocate Williams, in relation to education about city standards for respectful care at birth, healthcare proxy forms and patient rights, and proposed intro number 509-A, sponsored by Councilmember Stevens, in relation to a public education and outreach campaign on maternal mortality and morbidity, and a report regarding the incidence of cesarean sections. We are also voting on 4 resolutions, including Reso 95 and 205, sponsored by Councilmember Rivera, and Reso 244 and 92, sponsored by Public Advocate Williams. I want to thank my colleagues for introducing this important legislation, and I also want to thank all of the advocates who have been working tirelessly to improving birthing outcomes in our city, including doulas and midwives. Lastly, I want to thank the committee staff who worked on this package of legislation, Committee Counsel Habani Ahuja and Assistant Deputy Director Sarah Liss. On that note, I want to turn it over to Councilmember Hudson to hear about her introduction.
Thank you so much, Chair Schulman, and good afternoon. I'm excited that today the Committee on Health will be voting on my bill, Introduction 478A. As you know, this bill would require the Department of Health and Mental Hygiene to conduct an education and outreach campaign about the services offered by doulas and midwives, to increase awareness of efforts to improve access to such services and share information about free and low-cost resources related to such services. It would also require DOH-MH to submit a report describing the methods of outreach used to comply with this section. I'm proud that my first local law enacted as a member of the City Council directly relates to one of my proudest achievements, my Black Agenda for New York City, a policy blueprint aimed at improving the lives of Black New Yorkers, because when Black folks thrive, everyone thrives. Black folks are the most at risk of mortality and morbidity issues when giving birth, and my home borough of Brooklyn has the highest number of pregnancy-associated and pregnancy-related deaths. One clear way to reduce this gap is to provide doula access to more folks, to empower birthing people to speak up for their healthcare needs. I urge my colleagues on the Committee on Health to pass this bill and the rest of this package. Thank you again, Chair Schulman.
Thank you very much, Councilmember Hudson. On that note, I will turn it over to the clerk to call the vote.
Good afternoon. William Martin, Committee Clerk. Roll call vote, Committee on Health. All items are coupled. Chair Schulman.
No, aye and all.
Yeager.
Aye on all with the exception of Resolution 95, on which I vote no.
Hudson.
Aye on all.
Narcisse. Velasquez.
Aye on all.
Ariola.
Aye on all with the exception of Resolution 95, which I vote no.
So all items on today's Committee on Health agenda have been adopted by a vote of 6 in the affirmative, 0 in the negative, and no abstentions, with Resolution 95 being adopted by the committee. One moment. Resolution 95 currently has 4 in the affirmative, 0 in the negative, and 2 abstentions, and the roll will be held open at request of the chair.
We're going to hold the vote open. We're expecting other members of the committee to come and vote. Thank you. We still open? We just, yeah. So, are they? Well, no, before that, Councilmember Narcisse would like to make some comments. Okay. At this time, I would like to call on Councilmember Narcisse to make some comments.
Thank you, Chair, and all my colleagues. I would like to make that statement because it's very important, especially nowadays where we are with maternal health and all. In a city with a fair share of racial and socioeconomic inequities, one of the most glaring ones is the vast disparities which continue to exist in maternal health care. As a nurse for over 3 decades, mother of 4, woman of color, and member of this body, I am so proud that we have focused our efforts on reducing these disparities. The laws we are moving out of this health committee today will empower those giving birth in our city and increase education, understanding of the process, care, and expose them to the potentially life-saving resources they are fully entitled to. I thank my colleagues for their fair work, for their hard work on this important issue. Our efforts today will save lives and make our city a more equitable place for all, which that's what we're supposed to be, for all. For the Health Committee today, I thank you for the opportunity to be part of the team that sees women are an important key component of our city. So thank you.
Thank you, Councilmember Narcisse. We now will be on a temporary recess. Thank you. Public Advocate. We are joined by Public Advocate Jumaane Williams, who would like to talk about his legislation. Public Advocate.
Thank you, Madam Chair. Really appreciate it. As mentioned, my name is Jamani Williams, Public Advocate of the City of New York. I want to thank Chair Shulman and all the members of the committee for guiding these bills to today's vote. I have, for a long time, been pushing black maternal health in particular. Been an advocate in these bills. Will further push our efforts to eliminate negative impacts expecting mothers before, during, and after the birthing process. I began pushing these pieces of legislation about 2 or 3 years ago, never knowing how much it would affect me personally. People may not know, where I had these bills before, I had dealt with it personally, and that was a testament to having a very diverse staff. It was black women in particular on my staff that came to me with this problem. We pushed it. Lo and behold, it would affect myself and my wife just a few years after. In New York City, black women are 8 to 12 times more likely to die during childbirth than their white counterparts. This is often due to medical personnel minimizing, dismissing, or overlooking the health concerns of black patients. This, unfortunately, is much higher than even the national average of 2 to 3 times. Today, the committee will consider for passage in 1 proposed local law and 2 resolutions that I introduced. First, intro number 86, and co-introduced with Bronx Borough President Vanessa Gibson, will require the city to conduct a public education campaign in all facilities that provide obstetrics and gynecological care. The main goal of this bill is to educate patients about the city standards for respectful care at birth, healthcare proxies, and different rights they all have as a patient. Similarly, I have 2 resolutions that are being discussed today. Resolution number 92, co-introduced with Brooklyn Borough President Tony Reynoso, which calls on the United States Congress to pass and President Joe Biden to sign the Black Maternal Health Omnibus Act of 2021. Lastly, resolution number 244 calls on the Centers of Disease Control and Prevention to expand funding for By My Side, a doula program part of the Health Start Brooklyn. With more funding, this will allow doulas to be able to allow all low-income birthing people in New York City. For far too long, maternal mortality has been ignored. In particular, all pregnant women and people in communities of more color have disproportionately experienced maternal health care inequities. Our proposal today and resolutions will help change this unjust system that has long denied women and people of more color in our city the care they need and deserve. Having seen my wife, when before we had doctors who listened to her, I didn't even understand how bad it was until we found doctors that actually listened to her. And thankfully, my baby girl, Amani's healthy. My wife is now cancer-free. I also know we have access to a lot of privilege that people don't, and we want to make sure that we rectify this as soon as possible. So I just want to say thank you again to you and all of the committee members. Peace.
Thank you very much, Public Advocate. When we voted for all of the resolutions and the intros before you came here, and they all passed, we're actually keeping, we're just on recess because we have one other member who's going to come to cast their vote. Okay, you ready? Okay. So the Health Committee is back from recess. I'm going to ask Councilmember Barron to cast his vote for the legislation.
Thank you so much. I appreciate the wait and the time to vote, so I vote aye on all items. I went through them briefly, but any changes, I'll do it on the floor. But right now, aye on all.
Thank you very much. The committee hearing is now over.
1 second, hold on. Okay,
Sorry, we have to tally the votes.
Final tally now, items, the Committee on Health, all items have been adopted with a vote of 7 in the affirmative, 0 in the negative, and no abstentions, with Resolution 95 being adopted by the committee, 5 in the affirmative, 2 in the negative, and no abstentions.
Thank you very much. Now the committee is over.